A Philadelphia home health aide billed Medicaid while sitting in jail. Let that punch you in the face for a second. The Trump administration just busted 19 defendants in a Philly fraud ring. And that jail cell billing scam is only the start. And wait till you hear what Dr. Oz just said about 96% of these claims. We're talking about $33 billion in 2024 that vanished through Medicaid cheating. That's according to sources. That's your money, my money, and care meant for the sick and elderly getting hijacked by crooks and protected by bureaucrats like Andy Schneider, who actually tried to pretend states were not cheating. Okay? Did you hear me? Read that again. 19 defendants, over $4 million in fraud, one fake caregiver billing from prison, another so-called patient caught working construction. You can feel the rot right here. You see, Trump is not trimming paperwork. He's kicking in the door on the theft machine that Democrats let fester. And tonight, a market pressure story for seniors as plan costs and benefit designs keep on shifting. Millions of seniors overpaying for Medicare still face the same trap. Big insurance profits from confusion, mailers, robocalls, fine print, and keeps people locked into ill-fitting plans. Chapter calls itself a newsroom for your Medicare. It uses independent Medicare advisors, the only Medicare advisors who compare every plan nationwide. They review doctors' prescriptions, complete an entire file review, and report back with the truth on what actually fits. That means checking the story behind the price tag, not the sales pitch designed to keep you paying more. If you already have the right coverage, they provide best plan verification. If not, they will help you switch. The call, it takes under 20 minutes. It costs you nothing. Numbers on your screen right there. 910-728-4109. Give them a call before confusion keeps costing you more. Now, over 96% of Pennsylvania personal care victims say that, quote, illness is unspecified. Well, Dr. Oz warned that. And stop right there. If they cannot even name the illness, why are taxpayers getting hammered for more than $50,000 per beneficiary? And that detail blows this wide open. And now the tweets make even more sense. A jaw-dropping level of home health fraud has been exposed in Philadelphia. Charges against 19 defendants, and we have more details. Here's the initial news report on that.
6,200 defendants nationwide so far, allegedly responsible for more than $45 billion in improper private and public insurance claims. Now, Philly has a large aging population that relies on federal health programs, so it could be a very vulnerable area for this. And officials, they've already been working behind the scenes, with charges planned to be released today as well against 19 defendants involved in some really outlandish schemes. Now, Fox News has been told a little bit about some of these cases. I mean, this includes a home health aide who was billing for providing services while in jail. Another who investigators say claimed to be a person who was in need but was caught by federal investigators working a construction job. Home health care funds are intended to provide a lifeline for aging or disabled patients. It can allow a family member to provide that care if that's what fits best. But it's also, like I said, a really vulnerable system. It relies on the honor system. There's no direct supervision. The Justice Department, CMS, state attorney generals, they're now involved in making sure there's more oversight and arrests where need be. Guys.
All right, Alex Hoff, thank you.
Sure.
So that is the news brief on that. And now we go to what actually happened today. The administration announcing in a press briefing, this is Assistant AG Colin McDonald, announcing those criminal charges.
This team of public servants is committed to looking further, digging deeper, working night and day to unmask the fraudsters stealing the wealth of America and bring them to justice. And this commitment is reaping dividends right here and right now in Pennsylvania. Today, we are announcing criminal charges against 19 defendants for fraudulent home health care schemes that targeted Pennsylvania's Medicaid fraud program and resulted in over $4 million of fraud. 18 of these defendants were charged in the last 12 days as part of a strategically coordinated law enforcement operation between the Fraud Division, the U.S. Attorney's Office, and the Pennsylvania Attorney General's Office. The cases today build on the work that we recently announced in Minnesota, where we charged 15 defendants for systematically looting 7 state-managed Medicaid programs out of more than $90 million, treating those programs like a piggy bank until one of them had to be shut down entirely because there was nothing left. The shelves were empty. The Commonwealth of Pennsylvania is one of the highest spenders for home care services in the nation, with spending on home care services exceeding $8 billion in 2025 alone. These home care programs are designed to allow America's most vulnerable to live with dignity at their own home instead of being forced to leave their families for a nursing home. The program is innovative. It allows friends and family members to receive funds from Medicaid to provide necessary physical care for a loved one. Used properly by honest citizens, the program allows those with physical ailments to be cared for by those they trust the most. But infiltrated by greedy and deceitful opportunists, this program becomes a money tree, a gravy train for criminal fraudsters. The cases today make that abundantly clear.
Abundantly clear indeed. It's all there right out in the open. And Senator Kennedy in committee, this is great. What's your best guess as to how much per year cheating is costing the taxpayer?
Now, what's your best guess as to how much per year this cheating costs the federal taxpayer?
We released the report on this yesterday, Senator, and estimated that it's $33 billion. It was $33 billion in 2024.
Okay. And that's $33 billion that is taken away from the people who really need Medicaid. Is that right?
Yes.
Okay. Has anybody gone to jail for doing this?
Not to my knowledge.
Don't you think we ought to start putting people in jail for cheating?
I think that it's financial fraud against the federal government, yes.
Yeah, that's a big yes from me. So that was Mr. Brian Blaise, Ph.D., in committee with Kennedy, Senator Kennedy there. Going back to the press briefing with the Assistant Attorney General, Colin McDonald, with more details about this new Northeast Healthcare Strike Force.
Another step in our growth plan, we are announcing today that our Northeast Healthcare Strike Force team is expanding here to Philadelphia. This will place dedicated fraud prosecutors right here to further root out the fraud in Pennsylvania. This district has a long-standing tradition of not only prosecuting egregious frauds like the ones charged today, but also a history of excellent corporate enforcement, both civilly and criminally. In fact, today the U.S. Attorney's Office is announcing charges against not only individuals, but a company, a home health agency that participated in the fraud. We are proud to join in partnership with U.S. Attorney Metcalf to ramp up our collective efforts to root out fraud here in Philadelphia and across Pennsylvania. This remains the early stages of the build-out of our fraud-fighting team, with the support of President Trump, Vice President Vance, and the White House Task Force to Eliminate Fraud, Acting Attorney General Blanche, and the entire fraud-fighting apparatus. The Department of Justice will continue expanding our reach across the country to pursue all fraud, no matter how large, no matter how small, no matter how hard.
You know, it breaks my heart to even think. These guys are doing so much work. President Trump's administration, they're fighting so much fraud, and they're getting ahead of it. They're saving taxpayers so much money, millions, billions of dollars, really. And to think that if we lose the midterms, if we lose the White House in 2028, I'm afraid that all of this progress is going to be destroyed, and the fraud machine will be turned right back on. Because that fraud machine is part of the problem. You see, that money gets laundered back out and ends up in the Democrat coffers for campaigns and and contributions to organizations that are run by these different swamp creatures. I mean, just look what happened in Minnesota as a test case, right? All that money, and these fraudsters who were meeting with people like Walls and Ellison and Omar were taking pictures with them. And then they get arrested. Now, how do they get that access? A lot of them made donations. And that donation came from taxpayer money that was swindled through these programs. So it's a money machine that these Democrats need to keep employed to maintain their power structure. It's a sick, twisted cycle. President Trump is shutting it down. So that's why the midterms in 2028 are going to be the biggest fight that we've ever seen to maintain the progress and to maintain the dismantling of this fraud machine that has continued to destroy this country for decades. So continuing on, we have more from Senator Kennedy. This is a great exchange. What planet did you parachute in from?
Sir, I'm sorry. Don't you think we ought to put people in jail for cheating?
Senator, I do not believe states are cheating.
You don't believe they're
I do
cheating?
not believe
All
that.
right. If they were cheating, what planet did you just parachute in from? Sir?
Sir,
You don't
I've worked
believe
on
states
this.
Look at the
are
girl in
I've
the
worked
background.
on this program for a long time.
But I'm be
It's
sure to
not
understand,
perfect,
you don't
but
believe
states do not
you don't
cheat.
believe states are cheating.
I do not believe states are
Do
cheating.
you believe in the tooth fairy? Sir? Do you believe in the Easter Bunny? Do you believe that Jimmy Hoffa died of natural causes? You're not answering.
I do not believe states are cheating in their administration of the Medicaid program.
Okay. I'm glad you have some water in front of you because your pants are on fire.
Oh, man. That guy is a national treasure. There's no question about that. And now we're moving on. We got a clip from Dr. Oz coming up, but first we're going to go to the Deputy CMS Administrator, Kimberly Brandt, with a major update on the hospice fraud crackdown in California under the White House Fraud Task Force.
To build on that with an update on one of the areas where we've made the most progress, hospice. Since President Trump took office, 1,076 hospices have been removed from the Medicare program in California alone. This represents a 47% reduction in the number of California hospices compared to the peak during the Biden administration. To put that in context, Los Angeles County alone had more than 1,850 hospices. So these are hospices that are no longer under review. They're not on a watch list. They are gone, thrown out of the program entirely, unable to bill Medicare, unable to touch another taxpayer dollar, unable to take advantage of another vulnerable beneficiary.
So that was the Deputy CMS Administrator, Kimberly Brandt, with the update in California. Now we're going to cut to Dr. Oz with his, it's a longer cut, but it's important. Dr. Oz is obviously one of the driving factors behind this with J.D. Vance. Of course, we have to give acknowledgement to Nick Shirley for really, breaking the dam wide open in Minnesota, which has now led to this nationwide dragnet. But let's go to Dr. Oz.
We're facing a personal care services crisis around the country. The surge in enrollment of individuals in these programs is stunning. So shocking, we have to double check our numbers. We don't think it's possible that it's happening, but it is. In California and New York, the -- job in the entire state is personal care services. Guess what? It's good to be home because it's true in Pennsylvania too. 50% dramatically more people serving in the personal care services space, that's home care, than is in retail. That's where Pennsylvanians are going. It's becoming a jobs program. Medicaid fraud in this state is costing taxpayers for care that was never delivered, or even worse, harmful. It's costing patients their health, their trust in a system that was built in a high-trust environment, a place we all thought that we would be able to be safe because who would steal from the poor? as Colin outlined, many people unfortunately are doing just that, and we're coming after them. What we're exposing today is a diabolical breach of trust, a violation of the sacred bond between patient and caregiver. It is a catastrophe that can only be dealt with in the way we'll be outlining for the rest of this presentation. Today's defendants included an aide who billed Medicaid for care claimed to be delivered while they were in jail, or while they were being arrested, or while they weren't in the country. The list goes on, one more disbelievable than the next. And it's not just individuals. There's a home care agency, 2 owners who are charged with billing Medicaid hundreds of fabricated clock-ins. Again, care that was never delivered at all. And we have evidence of that. CMS's job is to make sure this money reaches the people who actually need it. That's the grandmother who desperately needs this money to stay out of a long-term care facility. It could be a vet who relies on this to get help because he's stuck in bed. All these individuals deserve our love and support, not the criminals who have hurt them. We've reviewed Pennsylvania's personal care billing trends. I'm going to give these numbers to you slowly because they're really important. This is the federal government's data on Pennsylvania. Pennsylvania ranks 5th nationally in average monthly payments, both per beneficiary and per provider. That is way out there. Be number 5 in both those categories. More expensive, that is, in 45 states. Over 96% of personal care claims here are illness unspecified. That's how they're titled. So we can't track them. It doesn't help if the U.S. Attorney or the Attorney General can't possibly find the fraud because people aren't actually telling us what they're really doing. We have to change that history that's evolved here into the norm. And finally, average payments per beneficiary, more than $50,000. Think about that, $50,000 per person getting home care in this state on average, far above what you'd ever expect. All this points to fraud. The cases like these are exactly why a whole government approach is so critical and why we have to develop best practices of how to evolve this system. You're going to be hearing from Dan Brillman in a second. He runs Medicaid. He's going to touch on another problem that's a big one in Pennsylvania, which is autism care services, and why they're, again, not only are they off the chart in Pennsylvania, but the rest of the country, but we are actually here to help. We're giving you a toolkit that will allow the state to be able to tell what's good, what's not, what's foul, what's fair, so we can identify the best use of our funds. Yesterday, I was in Maine. We're investigating home support services, just like you're seeing here, for adults in that case who have autism. Medicaid spending of the top 10 providers there has dramatically increased over the last 6 years. In fact, across the board, if you look at fraud in healthcare, all gone up in the last six years. What happened in 2020 that has catalyzed this? What has allowed this corruption to be weaponized? It's COVID. COVID appears to have unleashed massive fraud through grifters because criminals knew the federal government would not follow up on the money that was spending out. We told the world we were open for fraud and they could start harpooning us with their spears. No mas, no more. We are now making it very clear this administration will not tolerate this fraud. The massive increases that have grown to the kinds of numbers you could not imagine being able to show on a clipboard, with 90% of services billed and paid for, in Maine in particular, where there is no justifiable backup for it. 9 out of 10 services, you can't justify they should have happened. It's the opposite of what you'd normally expect.
The opposite. See, Colin McDonald just announced 19 defendants as Dr. Oz exposed illness unspecified on 96% of claims. And that combination tells you exactly how this racket survived. Crooks stole the care, bureaucrats hid the trail, and Democrats built a system so sloppy that a man could bill Medicaid from a jail cell until Donald Trump stormed in and started putting predators, agencies, and fake providers on notice. Philadelphia got 19 defendants. A jailed aide got caught billing Medicaid, and Colin McDonald just expanded the strike force right into the city. And that is the demand right now. Bigger raids, faster charges, harsher sentences, and no sanctuary for any agency, provider, or state official who fed the scam. We should hammer every corner of this fraud machine until the whole racket cracks open. Because Senator Kennedy put the number on the table, $33 billion a year. Share this report, drop your take in the comments, and make some noise, because the country needs more of this, not less. Trump is proving the so-called entitlement crisis got padded by theft, fake claims, and political protection. And I want every last parasite who looted the poor and sick marched into court. No more watch lists, no more seminars. It's time for jail. And that illness unspecified scam is exactly why our team keeps digging deeper than the headlines. And if you want the next hit before the platforms bury it, text White House to 844-840-4963. Next News Network is credentialed inside the White House, and we send a nightly briefing pulled straight from the building to your phone, first and direct. And if reading it is not enough anymore, just text the word signal to that same number and enlist in the Next News Signal Corps. Real missions, real ranks, and a command center for patriots who want to move the story and not just watch it.